Welcome back. Today we're going to talk about a very specialized and exciting treatment. It is hyperbaric oxygen therapy, and it can help with all sorts of issues, even depression and migraines. Dr. Priya Asija is a wound care physician with SAAK Health, and today she is here to talk about how this therapy speeds up healing and how it's now being used to treat other problems too. It's great to see you again.
Thank you
Doctor.
for having me.
Yeah, this is so exciting. I've seen the hyperbaric room that you have at SAAK Health. I know you're very excited about it. So tell us just a little bit about hyperbaric oxygen therapy, how it works, and what you use it for.
Hyperbaric oxygen therapy is high pressure oxygen in a closed filled chamber, which will improve tissue oxygenation and help heal the wounds faster.
So it's basically like putting oxygen right where the body needs it to sort of speed the healing process, and by oxygenating cells,
correct,
that's the body's response?
Correct.
Okay. So what type of wounds, because that's your specialty, do you feel you'll have good results with this therapy?
It would be venous ulcers, diabetic foot, gas gangrene, sudden vision loss, wounds which are taking more than 4 months to an year to heal will heal better.
Wow. So it can do things that you can't do with other standard wound care treatments?
It's a multi-specialty approach. That means we are going to use wound debridement, cellular tissue products, and also hyperbaric oxygen to help this heal.
So it's FDA approved. It's an FDA cleared treatment, the hyperbaric oxygen therapy for wound care.
Correct.
Now, what I think fascinating is there are some non-FDA treatment indications. So these are other things that you can help heal and treat with this therapy that don't fall into the category of wound care, right?
Correct. Correct.
So what kinds of issues?
These are chronic conditions like Lyme's disease. Lyme is so rampant in Wisconsin. We need tissue oxygenation that will help you. And then we have migraines.
Okay.
COVID-19, long COVID can help.
Really?
Yes. And also
what about
depression?
Yeah. Now, so depression in particular, how does this therapy work for depression?
It's basically increasing oxygen to the brain, and that will increase the serotonin inhibitors that will help
with the recovery from depression. I'm guessing you'd maybe need multiple treatments if
Correct.
you're using it for
Correct.
chronic conditions.
Correct.
You also say vision loss, because you mentioned that when you were first talking about FDA treatments and how it's cleared. So there's certain types of vision loss
yes.
that can be
yes.
helped?
Sudden artery occlusion
okay.
of the eye can help. This is one of the indications for FDA treatment for.
Wow. What about, because I was reading, what about after plastic surgery?
Yes, this increases surgical outcomes.
Wow. Just by oxygenating the cells again. So it's like, it seems like Alzheimer's too?
Correct.
Wow. It's amazing what can happen or with the body's own healing process if you give it the oxygen maybe it needs. It must be depleted in oxygen to be able to have that sort of result.
Yes, when you have any chronic condition or wounds, then there is oxygen starvation, and with increased pressure and with increased pressurized oxygen it increases the tissue viability and helps growth factors to increase the wound.
You must be excited about being able to bring this to people. Do people have to have a diagnosis for these different things in order to be a candidate for
Correct.
hyperbaric oxygen therapy?
Yes, yes. But certain like sports injuries, like athletes who want to recover after a big football match or a basketball match, can use hyperbarics to increase oxygenation for muscle recovery.
It seems very safe. A very safe type of therapy.
Yes, and you need every patient that goes into the hyperbaric chamber has to be screened by a physician to make sure everything is okay. We want to make sure their ears are okay, their lungs are okay, because you don't want to give anybody into the oxygen chamber if there is something wrong with their lungs.
Okay, that makes sense. You also have a special offer because when I visited SAAK Health a couple short months ago, you have a beautiful facility.
Thank you.
The room where you have the chamber was just being completed, the construction of it. So you're going to be up and running next week, and you have a special offer for people to try it if they qualify.
Yes, they do.
Okay.
So the special that we are running right now, the Medicare bills around $700 for a 2-hour treatment session for chronic wounds. For all the non-FDA approved treatments, we are offering $200 for 1-hour treatment.
Wow.
And this special is going to last for 2 months.
Oh, that's so nice. So that'll be this month and next month?
Correct.
Wonderful. That's a huge savings if it's usually billed at about $700 to think people can have the treatment for $200. And again, those indications are Lyme's disease, vision loss, outcomes after plastic surgery, Alzheimer's, long COVID-19, depression, migraines, and others. So great for people to give it a try. Thank you so much, doctor, for being here. Really appreciate it.
Thank you for having me.
Yeah, and it's important to say that not all wounds are the same. You can visit SAAK Health for personalized treatment. They want to remove the stigma that's associated with wounds and wound care. The new SAAK Health campus is gorgeous, as I mentioned. It's located on West Capitol Drive in Brookfield. To make an appointment, you can call 262-444-5148, or for more information, visit SAAK Health and check the spelling there on your screen, SAAK Health.com.